So on a booster update, we'll start with an update on our COVID-19 booster campaign. Since September, when the first category of boosters was approved, Rhode Island has administered 105,000 doses. And that means about 24,000 Rhode Islanders are rolling up their sleeves for booster shots each week. So we want to thank them for getting their booster shot. Most of these shots, about 73%, have been administered at pharmacies. So thank you to our pharmacies as well. And 65% of the people who are getting boosters are 65 and older. So let's keep the pace and continue to get the booster shots. If we continue at this rate, we could have 100% coverage of eligible people by the end of January. So I want to thank everyone who's gotten that booster shot, and these shots are going to be incredibly important to maintaining high level of defense against infection as we enter the winter months. I also want to thank, on the vaccination update 5 to 11, I want to thank all the families and the young people especially who have received their shot so far. Rhode Island started administrating pediatric COVID-19 shots on November 3rd, and since then 13% of Rhode Islanders, 80,000 eligible 5 to 11-year-olds have been vaccinated. And that means over 10,000 Rhode Island kids are on their way to full protection against the COVID-19. I want to thank our pharmacies, mass vaccination sites coordinators, and schools for serving as first pediatric vaccination sites. Pediatricians and family practices are starting to vaccinate now, and their leadership is so critical in this effort. Clinics appointments have been about 60% booked. This is a good start, but that means that Rhode Island has a steady supply of vaccine, and we're prepared to provide the 5 to 11 with their vaccination. Dr. Alexander Scott will talk more about this, but if you're hesitant to get your child vaccinated, please make sure to get all of your questions answered and get your child vaccinated as soon as possible. There are additional 22 clinics this week alone in schools and community centers, in addition to doctors' offices, CVS, Walgreens, Walmart, and Stop and Shop. If you feel like isn't a vaccination opportunity in your neighborhood or at the right time, please contact our office. We want to make sure that getting vaccination for the 5 to 11 is as easy as possible. So as we come up on Thanksgiving, we have so much to be thankful for, as we are in a very different place in the pandemic response this year than we were last year. But that doesn't mean that we're not going to be cautious about the measures that need to be followed to make sure that as we enter the winter season, that we control the issue in a way that's healthy for the people in the state of Rhode Island. So let's not let our guard down. Let's consider testing before and after you travel. Have a conversation with your loved ones about their vaccination status, and let's not take your chances. Why take chances? Stay healthy with each other and for each other. And as our teams continue to monitor cases over the next couple weeks, we'll provide a more holistic update of what our ongoing epidemic management responses will look like the first week of December and beyond. At that time, we'll provide updates on the Test to Stay pilot in our schools, masking requirements, and continued vaccination efforts. Shifting to the infrastructure bill. As many of you know, I was invited to be at the bill signing for the infrastructure bill yesterday at the White House. It was an honor to be there. You could certainly feel the excitement in the air. Rhode Islanders might have seen the bill signing in the newspaper or on the evening news, and I'm sure you're wondering what this actually means for us in the state. So I want to highlight a few concrete examples of what the bill means for us here in Rhode Island. I can tell you that it is a big deal for Rhode Island. Roads and bridges. There are 148 bridges and over 860 miles of highway in poor condition. And based on the formula, Rhode Island would expect to receive $1.5 billion for federal aid highway apportion programs and $242 million for bridge work. Rhode Island can also compete for $12.5 billion on bridge investment program for economically significant bridges, and nearly $16 billion of national funding in the bill dedicated for major projects that will deliver substantial economic benefits to our communities. And we'll definitely be competing for those funds. Related to public transportation, based on the formula funding alone, Rhode Island would expect to receive $272 million over 5 years. Electric vehicle charging is another area under the infrastructure investment, $23 million over 5 years. And Rhode Island will also have the opportunity to apply for $2.5 billion in grant funding dedicated to electric vehicle charging in the bill. Replacing lead pipes, which certainly is a high priority for us and people who are working to make that happen. I also want to point out funding to replace lead pipes. As I know, there is a strong interest in that, and it's the right thing for us to do. Across the country, up to 10 million American households and 400,000 schools and child care centers lack the safe drinking water. Rhode Island expects to receive another $378 million over 5 years to improve our water infrastructure and our water quality. These are just a few of the examples of what this legislation will mean to Rhode Islanders, and not to mention one of the most important things is going to mean jobs. As the President spelled it out, four-letter word, J-O-B-S. That is going to put many people to work over several years in the trades and in the union work. These will be all prevailing wages, which was one of our strategies, certainly, to make sure that we increase per capita income in the state of Rhode Island. This is going to help do that. Mentioned that we will definitely be competitive on our bid structure. I want to point out on the state health lab grant yesterday, and thank the Department of Health as well as Dr. Alexander Scott for her leadership on this issue in terms of the need for a new health lab in the state, and also her, certainly her advocacy in shaking every tree and trying to turn every stone to make sure that we are getting what we need in that respect. And certainly we're supporting that, as we did in last year's budget, putting a $6 million line item to help facilitate the effort. We received some good news yesterday. Yesterday we were awarded $82 million from the CDC to develop and build the Rhode Island Center of Excellence in Laboratory Sciences. In a more common terms, we received funding to replace our outdated, antiquated state health lab. I'd also like to express my gratitude for the congressional delegation and, of course, the Department of Health, the Executive Office of Commerce, and CDC for this sizable $82 million grant. Earlier this month, my office issued an RFP to develop a site for the facility for the Rhode Island Center of Excellence for Laboratory Sciences. The facility will be home to a state health laboratories currently located on Elm Street, Providence, and will provide additional private laboratory space. This is a win for the public health. This is a win for our local economy, another job opportunity as well, and this is a win for the future of the biomedical innovation here in the Ocean State, as we hold on to our, I think, second spot right now in terms of our economic recovery in the country. DEM announcement. I'd like to share an exciting announcement about Rhode Island's blue economy. A big thank you to the Department of Environmental Management and the leadership team, and to our federal delegation. Rhode Island DEM has received a $300,000 federal grant from the NOAA that will strengthen local seafood industry. DEM will work with Rhode Island Seafood Collaborative, a public-private group, to launch a campaign to raise awareness about the importance of supporting local fish and shell fishermen. Rhode Island's commercial fisheries are an economic powerhouse, and certainly they're included in our Rhode Island 2030 plan that the Lieutenant Governor and I, along with Commerce Secretary Pryor, are working on. That annual wild harvest totaled more than 80 million pounds of fish. That's more than 4,000 million in total economic output annually, supporting more than 4,000 jobs right here in the state. Rhode Island oysters are sought after throughout the region and the country, and also bring in millions of dollars annually. As we continue this pandemic recovery, this campaign will go a long way in bolstering an industry that Rhode Island is really proud of and very much dependent on in terms of our economy in the state of Rhode Island.